Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Segmental and Scruples series or edition. This audio podcast is part of a Rampage Sonar, and this audio podcast as part of a Blitz Logistics, and this audio podcast as part of a Storm Logistics production. In this audio podcast, a little bit around sort of transfusion alternatives. So different transfusion alternatives are known for sort of the pre, the intra, and the post-operative period or durations. Autologous blood donation and erythropoietin-based pharmacological stimulating agents are efficacious in the perioperative periods. Intraoperatively, acute normovolemic hemodilution, cell salvage, and antifibrinolytics, specific anesthetic and surgical techniques, coagulation monitoring, and accepting of sort of minimal hemoglobin values, and artificial oxygen carriers can reduce can reduce sort of can reduce sort of allogenic RBTs, or the use of the use of allogenic RBTs. In the sort of post-operative period, cell salvage, antifibrinolytics, and accepting minimal hemoglobin values represent alternatives to RBTs. Alternatives to RBTs should be given sort of a consideration. However, more focused evaluations of specific long-standing or long-term conditions, and/or chronic illnesses, chronic illness patient populations, and transfusion alternatives would help to clarify best use of treatment options, and taking into account renal function. That closes this audio podcast. This audio podcast as part of the Segmental Scruples series and/or edition. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Logistics. This audio podcast as part of a Storm Logistics production.